I'm Dr. Jeffrey H. Barsuk. I'm a hospitalist at Northwestern Memorial Hospital. Hospitalists primarily take care of patients that are admitted to the hospital. We're very involved in the quality of care and patient safety. I believe that if we teach effectively, we can significantly impact the care of our patients through the education of future doctors.
Okay, so what does that mean?
This is going to be my IJ,
Okay.
and this is going to be...
When I became an attending physician, I realized that there were several gaps in training that residents received. Particularly, I was concerned in the quality of education surrounding bedside procedures. Things like thoracentesis, which is drawing fluid outside of the lung, paracentesis, which is drawing fluid outside of the abdominal cavity, placing a central venous catheter in a patient that may be critically ill. These procedures are potentially life-saving. However, they are also associated with significant complications that can harm patients. The traditional way of training bedside procedures is what we call the see one, do one, teach one technique, where a resident might observe another colleague doing a procedure and then attempt one while they're watching them do the procedure and then actually do one on their own. This form of training is inadequate, and all it does is pass one mistake from generation to generation. Things had to change. So we developed a curriculum for bedside procedure training. Mastery learning is a unique method of training where we assure that everybody that goes through training reaches a high standard of skill before they're done with training.
Jeff saw an opportunity to provide high-quality education for resident physicians using simulation technology without having to resort to practice on patients.
He leads by example, and he leads programs that translate into the clinical environment in a very important way.
We came up with a model to help train the residents in bedside procedures that were necessary for graduation. We'd give them a pre-test, and we asked them to perform a simulated procedure. This baseline test kind of serves as their baseline performance, and it helps give the resident feedback as to what skills they need to work on later. And they'll watch a standardized video and a lecture, and then after they complete that, they'll have time to actually do deliberate practice with feedback from an instructor on the mannequin. Once this part of the training's over, they'll be post-tested. Residents that received training had a statistically significantly decreased number of needle passes when they put in the line, reduced number of arterial punctures, need for line adjustments, and they were more successful at getting the line actually into the patients.
The trainees, the resident physicians, develop a sense of what's called self-efficacy. They develop huge self-confidence in their abilities to practice medicine, to treat patients, because they know as a consequence of their exposure to simulation technology and deliberate practice and mastery learning that they're better doctors.
But what does that really mean for the patient? The results we have seen because of this include reduced catheter-related bloodstream infections in our ICU. If you get an infection, there's significant mortality associated with it, your length of stay goes up, and your overall health is diminished. We saw a precipitous, statistically significant decline in the number of catheter-associated bloodstream infections. Dropping just the catheter-related bloodstream infections alone saved our hospital over $700,000 a year, saved patient lives, and reduced ICU length of stay.
His research has proven unequivocally that simulation can reduce complications, save lives, and save healthcare costs.
That's a huge achievement that is rarely done in medical education, and we at Northwestern are very proud of Jeff for the leadership that he and his team have demonstrated in this area.
We've also sent a very powerful message about the importance of really assessing your skill instead of just assuming that you've learned it on the clinical floors.
So we actually have won international awards, and there's been a lot of recognition, but for us it's really not about that. What we're really concerned with is really affecting the future education of physicians, and even more importantly, quality of care and patient safety.